Today, we'll provide the latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Coming out of the holiday season, we're seeing how quickly Omicron has changed the landscape of the epidemic in Canada. In just a few short weeks, Omicron has spread faster and further than any previous variant. At the same time, we're seeing Canadians rise and adapt to the latest challenges by updating their vaccine protection, improving their mask quality and fit, and keeping up with multiple other layers of protection to reduce their risk of exposure and spreading the virus. Public health has also had to adapt in the face of the explosive spread of Omicron cases that has exceeded the testing capacity in many areas of the country. Although some of our earlier indicators, like daily case counts, are now strikingly high, while at the same time significantly underestimating the true number of new infections. This update puts more emphasis on some of the many other indicators that continue to be useful for monitoring current trends and predicting longer-range trajectories.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et de modélisation effectués au pays qui orientent la gestion continue de la COVID-19 au Canada. À la suite de la période des fêtes, on constate la
After the holidays, we are noticing the speed at which the Omicron variant has transformed the context of the pandemic in Canada. In only a few weeks, Omicron has propagated faster and more previous. So at the same time, we see Canadians reacting and adapting to the most recent challenge by updating their vaccine protection and by improving the quality to the adjustment of masks that they wear, and by maintaining other levels of protection destined to reducing the risk of exposure to the virus and propagation of this one. The public health as well had to adapt for the very quick spread of Omicron that overwhelmed the capacity in many countries. Even if a few indicators like the daily number is very high and the real number of new infections is considerably underestimated, the presence is mostly on other indicators that are more useful for monitoring the trajectory long term.
Slide 1. Since the last epidemiology and modeling update in December, despite being underestimated, current national case counts of over 37,500 new cases reported daily are far exceeding all previous peaks of the pandemic. The sudden spike in Omicron infections has daily case counts now trending far above the daily counts for severe outcomes. And while international surveillance shows that severity trends do not rise at the same explosive rate as cases, the record high volume of cases associated with the Omicron surge is nevertheless expected to heavily impact hospitals. Although there are likely to be continued challenges before we hope to see improvement, caution and perseverance will help to get us through this difficult period sooner and mitigate the impacts on our severely strained health system.
Diapositive 2.
Slide 2. With infection rates that are very high, that are over the screening capacity in a large part of the country, a lot of other indicators like lab testing are useful to monitor the activity of the disease within the population. Currently, the percentage of positivity and lab testing is 28%, meaning that the virus is detected in more than every fourth test. So even if jurisdictions have prioritized screening for those who are at risk, severe diseases or exposure, the positivity rate, current rate, shows that COVID-19 propagated broadly and underestimates the real burden of the infection within the general population. Now, following the trend for this indicator can help us determine whether COVID-19 is still widespread or if it's starting to establish in certain regions of the country. At the same time, other indicators continue being used at the same time to monitor other aspects, including trends in terms of severity.
Slide 3. That Omicron is the most contagious variant observed to date is evident from these curves, showing the sudden increase in the proportion of cases due to Omicron, shown by the red curve on the right. First reported in Canada in late November, Omicron has rapidly replaced Delta to become the predominant variant circulating in Canada as of mid-December.
Diapositive 4.
Slide 4. The trends for hospitalizations are indicated for the 6 provinces with the most population. Now, as opposed to the previous waves during which the propagation of the disease was generally well managed in certain smaller jurisdictions, the increased cases due to Omicron is generalized throughout the country. Even if the data shows that the risk of hospitalization is lower for the Omicron variant than for the Delta, the case of severe diseases still happen with Omicron, and the repercussions on the health systems and other sectors can be substantial. This can be explained by the increased hospitalization and admissions to the ICU, as well as by the increase of number of sick employees and who have to isolate. Already, the huge number of cases has started stimulating an increase in trends of severe disease nationally. These increases are more obvious in Ontario and Quebec, which have been the first to see the spread of Omicron, but most regions in the country should see or should expect to see a strong increase of daily numbers of hospitalizations over the next few weeks. Since the last update, the number of people with COVID-19 treated in our hospitals has more than quadrupled to attain an average of 6,779 daily hospitalizations, whereas the number of people in the ICU has doubled to get to an average of more than 884 cases per day, and 84 deaths have been signaled daily. Maintaining the infection levels to low levels is essential to attenuate the trends of severe disease as much as possible over the next few weeks.
Slide 5. The incidence of reported cases is higher across all age groups than at any time previously during the pandemic, as opposed to previous weeks when rates were highest among 5 to 11-year-olds who were just becoming eligible for vaccination. Incidence rates are currently highest among adults aged 20 to 39 years. With Omicron's greater ability to evade prior immunity from infection and vaccines, cases are now increasing in all age groups.
Diapositive 6.
Slide 6. Even if the global number of cases has rates of hospitalizations in all age groups, the split by age of hospitalization is similar to the previous wave of the pandemic, with higher hospitalization rates observed in older Canadians. Over the past month, the cases of severe diseases, including hospitalizations and ICU admissions, have been the highest in adults 60 plus, and particularly in those over the age of 80. At the end of the day, the impact in the population will depend on the overall number of cases causing severe disease. So all we can do to slow down the spread contributes to attenuating the individual and collective impact. In younger age groups, the cases for those under the age of 1 are 7 times more likely to be hospitalized versus children between the ages of 1 and 4. Although the number of hospitalizations has increased comparatively to previous waves, it is still low overall, representing less than 1% of cases signaled under the for those under the age of 5. Happily, admission rates in the ICU continue being low. However, maintaining the infection rates as low as possible, we can reduce the number of severe diseases in children.
Slide 7. Omicron's rapid rate of spread is likely due to a combination of inherent characteristics of the virus that makes it more transmissible and increased ability to evade prior immunity from past infection and vaccination. Similarly, Omicron's lower severity profile, as seen in international and Canadian data, is likely due to characteristics of the virus and protection from severe disease as a result of vaccination and or prior infection. This is supported by the fact that those with 2 doses of vaccine are less likely to be admitted to hospital, and this protection is increased with an additional mRNA vaccine dose of either Moderna or Pfizer COVID-19 vaccines. While considerably lower proportion of Omicron cases are being hospitalized compared to Delta, severe illness does occur with Omicron, and the impact on the health system and other sectors is expected to be substantial. Hence, vaccination, including getting an mRNA booster dose as eligible, continues to be important in combination with timed and targeted public health measures and individual protective practices for slowing COVID-19 infection rates and help to reduce impact on healthcare capacity. As well, despite a high number of outbreaks being reported in long-term care homes and seniors' residences, preliminary evidence indicates that these outbreaks are associated with less severe illness and the number of deaths remains low. However, as seen with hospital outbreaks, these outbreaks can involve a high number of cases among staff, which is contributing to reduced staffing levels.
Diapositive 8. En tout, plus que 72 millions de
more than 72 million of vaccines against COVID-19 have been administered in Canada since the start of the vaccination in mid-December 2020. However, even though Canadians over the age of 12 have a vaccine coverage of more than 83%, having received at least 2 doses of vaccines, the coverage is much lower in children between the ages of 5 and 11 who recently became eligible to vaccination, 48% of them having received 1 dose. Total, there's more than 6.5 million Canadians presently admissible for vaccination who are not yet vaccinated or who received less than 2 doses against COVID-19.
In terms of additional doses, 11 million COVID-19 vaccines, 3rd doses, have been given, the majority of which are booster doses. While we are making progress in updating protection for those in higher risk groups, including older adults, we need to continue efforts to increase vaccine coverage to enhance protection for everyone we can. As seen in this chart, a considerable proportion of Canadians who have received at least 2 doses still need an additional dose to restore protection that may have waned since completing their primary series.
Diapositive 10.
Slide 10. The fact of being completely vaccinated, having received at least 2 doses of vaccine, continues to offer good protection against severe disease requiring hospitalization. In this graph, the shape of the graph in those who are unvaccinated is concordant with the overall incidence of hospitalizations during the increase or lowering of the Delta wave and the increase of the Omicron wave. Now, the hospitalization rate of vaccinated Canadians has stayed stable with Delta and is just starting with the Omicron wave. So it's important to note that based on the hospital data, those vaccinated to around the age around December, the majority of vaccinated people, the hospitalized people, inaudible. So more than than a third with COVID-19 were admitted for other reasons. These trends clearly show that the fact of being vaccinated with 2 doses or more offers high protection. From November to December, when Delta was the predominant variant, people who were unvaccinated were 19 times more likely to be hospitalized, whereas the administration of booster doses, being up to date with our vaccines for COVID-19, should preserve this protection advantage.
Slide 11. This updated longer-range forecast shows how the Omicron wave could evolve in the coming weeks as cases continue to accelerate across the country. It is important to note that this trajectory estimates the true number of daily cases as opposed to reported cases that may be occurring in Canada each day. Due to constraints on testing capacity, these numbers are much higher than can be detected. In fact, exceeds the number of cases reported in the surveillance data, shown here as orange dots. The 2 scenarios shown on the slide, both of which incorporate the impact of booster doses, suggest that the Omicron variant could cause a large wave that may peak in January and then recede into February. However, it's important to remember that these are modeled scenarios and the timing of the peak is likely to vary across the country. The red line trajectory shows that without recent strengthening of public health measures in many jurisdictions, the Omicron wave could have peaked at about 300,000 actual daily cases. Whereas the blue line trajectory shows that with the recent implementation of stronger measures, we could experience a peak that is lower, with about 170,000 actual daily cases. These scenarios highlight that while combined public health measures and booster doses could help reduce the size of the Omicron wave, in either scenario, the true number of daily cases driven by extremely high transmissibility of the Omicron variant could still vastly exceed anything we have experienced to date during this pandemic.
Diapositive 12.
Slide 12. This new modelization for new hospitalizations anticipated daily helps us understand how the exponential growth of cases could affect our healthcare system over the next few weeks. By supposing that the number of Omicron cases will follow the trend and the interior line of the previous slide, continuing with the current public health measures in many places in the country, this shows that both, including new daily hospitalizations. So the direction of the yellow line shows the potential impact on hospitalizations if the hospitalization rates for Omicron were as high as Delta. So the blue line shows the potential impact if the hospitalization rates were 40% of Delta, as the evidence is being showed for the gravity in Canada and abroad. This is the scenario, shows that even if we use the lower prediction for the number of cases and hospitalizations, it's much lower for Omicron. New hospitalizations could still go over the historical peak represented by the horizontal green line because of the high number of cases which could happen. It's important to mention that this only takes into consideration new hospitalization and not the total number of people hospitalization with a disease linked to COVID-19. But no matter what, we expect the number of hospitalizations, daily hospitalizations, to be a deep burden for the healthcare system over the next few weeks.
Experiences of other countries that also experience an Omicron surge provide additional insights into how the pandemic may evolve in the weeks to come. Countries like the United Kingdom and United States that experience a sudden and very steep rise in Omicron cases also experience a sharp rise in hospitalizations. However, given the lower severity profile of Omicron, hospitalizations haven't increased at the same explosive rate as cases. Nevertheless, the sudden acceleration and enormous volume of cases associated with an Omicron surge puts an intense strain on hospitals over several weeks and adds to longer-lasting impacts, such as extended backlogs and strained workforce. With early signs that the surge in cases and hospitalizations may have peaked in parts of the US and UK, it is hoped that the heaviest impacts will soon be over in these countries. Likewise, if Canada's trajectory continues to follow a similar path, we are hopeful that cases will soon peak.
Diapositive 14.
Slide 14. So while Canada could attain a peak and then a decline of number of cases in the next few weeks because the activity of the disease is far beyond previous peaks, even the slope of this curve will be considerable, with many intense weeks of activities expected. We need to do our best right now to limit the flame-up of Omicron, to preserve the healthcare system and the critical functions of society. In practice, we need to continue to first be up to date with our vaccines against COVID-19, including receiving the booster doses when we are eligible. mRNA vaccines, Pfizer or Moderna, are effective as booster doses, so be confident by accepting the vaccine that is given to you. Second, limit the personal contacts for immediate members of your household as much as possible, and systematically use layers of personal protection to reduce the risks of exposure and spread of the virus by following local guidelines for public health, wearing a good quality facial mask that is well adjusted, and maintain good ventilation. Thank you.
So I'm just going to repeat the last slide, slide 14. So while Canada could see a sharp peak and decline in cases in the coming weeks, given disease activity far exceeds previous peaks, even the downside of this curve could be considerable. With several weeks of very intense activity expected to come, we need to do our best now to limit the size of the Omicron surge in order to maintain the health system and critical functions of society. Practically speaking, we need to continue to, 1, get up to date with COVID-19 vaccines, including getting a booster dose when eligible. Either the Pfizer-BioNTech or Moderna mRNA vaccines are effective as boosters, so please feel confident in accepting whichever vaccine is offered to you. Secondly, limiting in-person contacts to immediate household members as much as you can. And thirdly, consistently use layers of personal protection to reduce the risk of exposure and spreading the virus by following local public health advice, wearing a good quality and snug-fitting face mask, and maintaining good ventilation. So thank you. Merci. Megwidge.